Hello, my name is Madison Hegler, and today I'm going to be talking about bovine spongiform encephalopathy, also known as mad cow disease. All right, so about this virus structure. So it is caused by a self replicating protein called the prion. Um, Other pathogens like bacteria and viruses use DNA to make copies of themselves, but a prion is just a deformed version of a normal protein that's found in cell membranes. So, BSE belongs to a family of diseases known as the transmissible spongiform encephalopathies (TSEs). Some of the proteins can just go rogue and get bent out of shape, and we don't really know why this happens. So, about the replication of BSE, so once the proteins become prions, those same prions can bind to more proteins and make them bend in the same way, which makes a bunch of corrupt prions. So, clumps of these prions spread throughout the nervous system and then to the brain. This can take a really long time, though. Um, So, a little bit more. So, PRPC is a protein which occurs naturally and is found in cells of the central nervous system, such as the brain and spinal cord. And so, this makes BSE very virulent because um, the prions clump together and go up and attack other good proteins and basically attack those proteins that are attached to the brain and to the spinal cord, which causes it to be extremely harmful to its host as it progresses. So the bent protein, also known as the prion, infects other normal proteins and makes them prions. So this disease causing form of the naturally occurring prion protein is termed PRP scrappy. And its difference to PRPC only in its tertiary and quaternary structure. Um, and they're very similar. So as you can see, scrappy up here is this is what's found in a mouse's brain, and it's part of that TSE family, that spongiform family, and it gets its name from the kind of sponge-like holes it makes in the brain. It just degrades the brain tissue. And so here's on the bottom left, you can see what a healthy brain cow brain is supposed to look like, and here is what a cow brain looks like when it has the bovine spongiform encephalopathy. So, about the disease progression of mad cow disease. So, clumps of these prions, once they spread throughout the nervous system and then to the brain, the central nervous system just starts slowly being degenerated over a long period of time. I mean, this incubation period can take 5+ years sometimes. And so, um, it just causes the brain and nervous system to just wear down and cause those sponge-like holes that we saw, um, and causes severe behavioral changes. I mean, these cows can exhibit severe nervousness, aggression. They can have coordination problems like difficulty standing due to that nervous system damage, and even rapid weight loss and decreased milk production. And so, basically, once these symptoms start, if you think about it, the incubation period of these prions affecting all these proteins on their nervous system and brain, I mean, that incubation period, that is ongoing up their spinal cord, up to their brain for years. So by the time it's up to these animals' brains, it's too late. And the symptoms are so onset that the cattle usually only have anywhere from 2 weeks to 6 months left to live, before it kills them. So, about how BSE got started. So, we're not entirely sure of the exact origin, but we believe it's most likely, which is pretty gross, it's most likely due to cows being fed ground up meat and bones of dead sheep and other cows who had the similar protein called scrappy, that spongiform, that TSE. Um, and so, but, some people also believe it could have just been, a weird protein that got folded the wrong way and started all of this. We're not really sure, but it started somewhere. And so the cattle getting fed um, these dead cows that were ground up that already had BSE, and these dead cows that were ground up that had BSE were being fed to healthy cows. So it definitely made it worse, and it was just this ongoing cycle until someone realized what was going on. And so what made it really difficult to like how to catch and how to figure this out was due to BSE. The prion agent is so resistant to enzymatic breakdown in most disinfection treatments. So, like during even the process making of the feed for the cattle, we couldn't even eliminate the prion because it's just so strong. So, mad cow, we know about mad cow disease, but sometimes people even refer to variant Creutzfeldt-Jakob disease as mad cow disease in the human form, because they are so similar. And so it's also caused by bent prions. Origin, we're not really sure how it happens, but we believe it stems from eating infected cattle and that same bent prion. But we believe it stemmed from eating infected cattle due to it kind of going on. So all that infected cattle from mad cow disease was going on in the late 80s and 90s, and it was very concentrated on the UK area. It wasn't American cows getting infected. It was all going on in the UK. And so when variant Creutzfeldt-Jakob disease came out, it was also in the UK. But it started in the 90s, late 80s. But scientists believe that it started in cattle during the 1970s just because it took so long for the incubation period. Um, so, also similar to BSE, once symptoms start to show up, they escalate very quickly once they do. The brain degeneration causes trembling, trouble walking, dementia. It can lead to a coma, severe behavioral issues similar to BSE. And so, unfortunately, there's no cure. Patients usually die within a year from when symptoms start. Um, and there have been about 230 cases of CJD worldwide. It's extremely rare, and 180 of those are from the UK, and the rest are from Europe, and only 4 in the US. But all the four, all of those 4 from the US were picked up overseas. And so you can see the picture on the right side that it's that same spongiform pathology that shows very similar to BSE. And the brain shrinkage and deterioration just happens so rapidly in these patients. So the transmission of CJD it is believed that people became infected through consumption of cattle products contaminated with BSE. In 3 cases from the United Kingdom, each reported through a recipient of blood, and that blood came from an asymptomatic infected donor um, who ate from infected cattle of BSE. So there are no treatments for CJD. It's very fatal, but there has never been a case of CJD that did not have a history of exposure within a country where the cattle disease BSE was occurring. So this is kind of like more linked to like the origin of, we think these two things are very closely related, and we think they kind of stem from the same thing. I wanted to talk about a case study of CJD because it's kind of unique. This patient is an outlier. He's a male in his mid 40s, and he was actually born and raised in the Middle East, which makes him an outlier because most of them were from the UK. Um, So he presents with very intense symptoms. He has paresthesia, which is a burning or prickling sensation. And I mean, that's just, I couldn't even imagine. In his face and his left arm, all in his like head, neck, spine area, just this burning and pricking sensation. And so his initial scans just show fluid and like kind of these like slow degenerative changes like along his spine. And so he was initially diagnosed as cervical disc disease. So they gave him treatment for that. And despite his treatment for that, his symptoms persisted. I mean, he kept coming into the ER. He was having these psychotic episodes, depression. I mean, just severe behavioral um, trauma and issues were going on. So after 14 months of horrible symptoms, he shows up to the ER again and he's given another MRI. His MRI shows brain volume loss and leads to his diagnosis of variant Creutzfeldt-Jakob disease. This patient dies just 3 months later after that last MRI. And you can see on the upper right, his brain autopsy presents that prion plaque, that same spongy material, brain scans, and it just shows this how this disease escalates so quickly to death over a matter of months. It's really sad. So I have some graphs here of how BSE and CJD kind of overlap. Of course, BSE skyrocketed late 80s, early 90s, and you can see in 94 is when CJD started to have that overlap, and we believe that's due to the incubation period. And you can see here, I mean, the deaths from CJD were just, I mean, booming, but that same 1994 overlap, where you can see that it started to stem around the same time period and um, due to that incubation period of the disease. So, treatment and prevention and control. So, as we talked about, there is no cure for bovine spongiform encephalopathy or variant Creutzfeldt-Jakob disease. For CJD, most doctors will just treat pain, do some pain management to make the patient as comfortable as possible before they pass. Um, and some prevention. People cannot donate blood if they've been in high risk countries in that area, especially during that time period for too long. And then, of course, here comes the FDA. A little too late, but better late than never. And in 1997, the FDA implemented regulations that prohibit the feeding of most mammalian proteins to cattle. So they basically said, don't feed these cattle these like dead animals. Then finally, it was still going on after 1997. We didn't know cows were still getting BSE, and even though they weren't eating dead mammal proteins, and it was still going on. So it took them until 2008 to finally figure out and strengthen this ban. And it included prohibiting the inclusion of SRMs, which include the brain, spinal cord, eyes, skull, their vertebrae. They couldn't include any of that in animals 12 months over age in any animal feed. And it also prohibited the use of all cattle carcasses that were not inspected and passed for human consumption unless the cattle are less than 30 months of age, or the brains and spinal cords have been removed. So that's pretty freaking gross, and just shows how long it had to take until we started seeing results. 2016 is the first year no cows were infected with BSE. So that is how the FDA went about it. But then again, bovine spongiform encephalopathy is extremely rare, as with CJD. And that is my presentation on mad cow disease. Thank you.